Today's topic is the one that may not be the most pleasant, but it's important nonetheless. Genital warts. Yes, we're going there. But trust me, this is a conversation you don't want to miss. Whether you're looking for information on prevention, treatment, or just want to know more about this common sexually transmitted infection. Let's start with what genital warts really are. Genital warts are a sexually transmitted infection caused by human papillomavirus, more commonly known as HPV. There are over 100 different types of HPV viruses. The ones that cause genital warts are type 6 and type 11. Genital warts appear as small bumps or growths in the genital area and can be transmitted through skin-to-skin contact, usually during sex, and also by sharing sex toys. Now, let's talk about statistics. Genital HPV infections, like genital warts, are common, affecting about 10 to 20% of the population. The number of people getting infected with HPV is increasing. Most people who get infected are between 17 and 33 years old, with the highest number of cases occurring in the 20 to 24 age group. In terms of geographical location, there is no significant difference in the prevalence of genital warts between emerging and the developed world. However, access to healthcare and education about STI prevention and treatment can vary in different regions. The global incidence of genital warts may be underestimated since many people with HPV infections are asymptomatic and may not seek medical attention. Therefore, it's important to prioritize regular STI screening and prevention efforts to help reduce the transmission and impact of genital warts. Now, let's look at some of the symptoms. You must go to a sexual health clinic and get it checked out if you have any one of those. Number 1, itching or bleeding from your genitals or anus. Number 2, one or more painless growths or lumps around your vagina, penis, or anus. Number 3, a change to your normal flow of urine. For example, it's begun to flow sideways. And number 4, a sexual partner who has genital warts, even if you don't have any symptoms. If you suffer from any one of those symptoms, you should visit a sexual health clinic as they specialize in treating STIs. A doctor or a nurse can usually diagnose warts just by looking at them. They may ask you about your symptoms and sexual partners, look at the bumps around your genitals and anus, and possibly may need to look inside your vagina, anus, or urethra, which is where pee comes out, depending on where the warts are. Now, let's talk about treatment. The type of treatment you'll be offered depends on what the warts look like and where they are. The doctor or nurse should discuss this with you. Typically, there are 3 ways genital warts can be treated. Number 1 is using creams or liquids. You can usually apply this to the warts yourself a few times a week for several weeks. But in some cases, you may need to go to the sexual health clinic where a doctor or nurse will apply it for you. These treatments can cause pain, irritation, or a burning sensation. Number 2 is surgery. A doctor or nurse may cut, burn, or use a laser to remove the warts. This again can cause pain, irritation, or scarring. And finally, number 3 is cryotherapy, where a doctor or a nurse can freeze the warts using liquid nitrogen. Sometimes the treatment is repeated several times, and again, this can cause pain or soreness. Bear in mind that it may take weeks or months for treatment to work, and even then the warts can come back. And in some people, the treatment just does not work. There is also no cure for genital warts, but it is possible for your body to fight the virus over time. Finally, let's talk about prevention. You can stop genital warts from being passed on by practicing safe sex. Condoms are usually effective. However, if the virus is in the parts of the skin that is not covered by a condom, it can still be passed on. It is also a good practice to not have sex whilst you're having treatment for genital warts. Also, do not share sex toys with others. If you do share them, wash them or cover them with a new condom before anyone else uses them. Please note that you do not get genital warts from kissing and sharing things like towels, cutlery cups, or toilet seats. Remember that education and open communication about STIs is the key to promoting healthy sexual behaviors and reducing the stigma surrounding sexual health.
Thanks for tuning in, everyone. Please like and share this video and subscribe to our channel. Together, let's build a world where sex education is a human right.